Hi, my name is Brittany and I'll be doing a video presentation on mobility and aging. First, we'll be discussing health concerns. I'm going to speak about intrinsic and extrinsic factors that are related to mobility issues. First, intrinsic factors are specific to the individual. These factors are reduced vision, unsteady gait, effects of medication, and acute and chronic illnesses. In relation to intrinsic factors, as I stated, reduced vision, this can be either cataracts, it can be visual spatial deficits, it could be glaucoma, it could be presbyopia, or age-related macular degeneration. As well, unsteady gait. Again, we're speaking about intrinsic factors. So you have things such as decreased strength and mobility, you have limited range of motion, and then you have factors that can also be health-related, such as sarcopenia, arthritic conditions, as well as osteoporosis. You also have medication side effects. Now, this is a very big, broad area, but just to be straight to the point, there are neuroleptic, benzodiazepines, antidepressants, sleep medications, as well as heart medications such as antiarrhythmics, beta blockers, things like that can cause dizziness, as well as syncope and things like that, all which can alter, make a patient false precaution, cause falls, change visual acuity, and so forth. Health concerns also, we went over the intrinsic, now I'll go over the extrinsic. The extrinsic is things that are related to the environment. So this would be inappropriate footwear. Things like footwear is almost as worse as not wearing shoes or footwear at all. Okay, lack of support equipment. This would be things like handrails in bathrooms or in shower stalls for older people to kind of just for mobility, as well as improper use or inadequate access to mobility items such as walkers, canes, wheelchairs, and things of that nature. And then we have conditions on the floor. So when we say extrinsic and we're related to the environment, this can be rugs, carpets, poor conditions of stairs, and things of that nature, okay? So nursing interventions, I'm sorry, I have something in my eye. Nursing interventions, this is very patient specific. Mobility is no different than any other specialty or any other relation in nursing care. We always cater it to the person. But the thing with gerontology and what I've been reading in our book for this particular section is really diving in and finding out what the fall or what is going on with the patient in relation to mobility. So as we've stressed is really doing an acute assessment on the patient to kind of determine these things. So what I did learn in this is that with mobility, we kind of chalk things up with gait and mobility due to age, but really falls actually mean that there's something further going on with the patient related to their health, especially if they were in decent health prior to the fall. It means something more indicative is going on, and we need to actually, again, really doing that thorough assessment to find out what's going on, because it means there's something more. Like I said, I'm kind of being redundant at this moment. So as I've highlighted there, again, doing a meaningful assessment, finding the reason for the behaviors. Our next slide, I kind of did a bunch of examples into this. So if your patient has had a previous fall, the biggest thing again is finding the underlying reason. So was this fall due to maybe medication use? You know, is the patient on a lot of sleep medications? Is this a fall related to the environment and so forth? You know, are they on benzos? Are they on sleep medication? Are they on antiarrhythmics? Did it have to do with vision? Did they have a bout of, you know, orthostatic hypotension and so forth? And you can kind of base your interventions off of that. You know, if you find out that they're on a whole lot of sleep medications, well then do a review, a complete review of medications. If you notice that in your assessment you find that a fall could have been more in relation to a gait disturbance, then you can actually have the patient do a sit and go, okay? That is a, you know, part of your assessment, and then you can, as an intervention, you can order physical therapy, consult. You don't have to have a doctor's order for that. That is actually a nursing part of your nursing plan, okay? That's an intervention. You can put up fall interventions, you know, putting that wristband on, making them a false precaution, you know, putting the gait belt on every time you get them up, making sure there's a walker by the bedside, having a 2-person assist, things of that nature. You can do a musculoskeletal examination, and then upon discharge, you can make sure that case manager gets with the patient and has a home health nurse do a evaluation of the home for hazard reasons for the fall. Again, carpets, rugs, is their bed too high? You know, maybe they have stairs that aren't safe going in or out of the home and so forth. Maybe they need a ramp into the home. There's a lot of different reasons why, you know, our elders fall. For teaching and learning, so it's very important, especially in old people, same thing as young, but we really teach it in old because primary care providers aren't as verbal with our old people as they are with the younger population when they seek medical care, going in and telling them that they need to be exercising. So it's the same thing for them as it is for the younger population. 30 minutes of moderate intensity aerobic activity, 5 days a week, okay? You can educate them to let them know that this doesn't have to be 30 minutes consecutively. You can break this up into 3 different 10-minute sessions if they need. It needs to be at least 10-minute sessions for them to really get that activity out of it, okay? I listed examples on the next page for you guys to follow of what these could be. So it can be pushing a lawnmower, okay? That's about a 10-minute at least workout of, most people don't have, you know, yards smaller than that. And you see a person climbing stairs here. 2 days a week of muscle strengthening activities. This includes all muscle groups, okay? You have the picture down here showing them lifting weights. That's good, small little dumbbells. Sit-ups, push-ups, as well as vigorous gardening. Another thing that you need to educate the older population on is to keep them well hydrated. They can become dehydrated because of perspiration. And remember, with gerontology nursing, is that with older age, they're at increase for dehydration because their total body water declines with age, okay? What I found with alternative care options is that in the hospitals, obviously, it's always a mobility issue. A lot of people come in, they're on more than 4 medications, which automatically puts them at a falls risk. They come in with gait issues. There's a lot of things going on. We don't want them to fall when patients become confused because of sleep medications or altered mental status because of whatever's going on. They have a UTI. We don't want them fighting. When they become combative, we make them, you know, sometimes they get into restraints. We're trying to steer away from that. Obviously, that even puts them at a more risk of health declination because they're not getting up and moving around the way they should be. Even though we don't want them to fall, it just becomes a steady thing that, we don't want them to decline. So they came up with this option right here. It's the restraint-free care. And if it's possible, what this is, it's consultations led by geriatric nurse practitioners, and it's where they round, and they also use college and high school students that they kind of actively assist in and out of the rooms, helping eyes on the patient. They walk them around, they do things with them, and it just is vigorous staff training and educating the patient and family and so forth. So this is a alternative care option. And that's it. I used the book for all of my education on this and referenced Toffee and Jet. Thank you.